Alopecia areata. It's actually autoimmune disease. It's not
Yeah, I would love to ask you about that concern actually because it happened to kira kenalan kan kita nampak macam especially lelaki lah. Tiba-tiba bila diorang gunting rambut, kita nampak kenapa macam ada ball spot. So then baru I came across with the word alopecia. So actually itu concern dia apa doktor?
Alopecia areata ni is autoimmune. It's actually an autoimmune condition where the body punya immune system react with the hair follicle.
Okay.
So usually the symptoms is benda tu akan jadi bald, lepas tu dia recover, dia jadi bald tempat lain. Lepas tu dia recover, dia jadi bald tempat lain. So actually treatment dia is by steroid injection lah. So we suppress the autoimmune reaction. And then dia akan recover lah. So it's autoimmune. So they have to be careful. So this type of patient is not, treatment is not a hair transplant. So hair transplant is at the essence of hair transplant is still a medical or surgical process.
Okay.
So even though it's called cosmetic, but it's still a surgical process, meaning that when we want to do hair transplant, we still need to properly assess the patient in terms of the medical assessment.
Yeah.
And you get a proper diagnosis first.
Yes.
And baru you do transplant. So kalau every patient we just do transplant, tak boleh. It doesn't work that way. Because you see, remember, sometimes it's physiological. Macam postpartum, banyak juga patient post delivery jumpa I.
Okay.
So I told them, you don't worry, this one you akan recover, you don't need transplant. Some of them want transplant because they're very worried.
I see.
So I said no need. Dia bagi some shampoo booster. So true enough, after 6 to 9 months, the hair grow back and they're happy. Some patient yang alopecia areata dia pula, datang pun sama. We said, okay, not for transplant, but we give injection, then recover.
Yang itu berapa lama kalau dia kena ambil treatment untuk
biasanya dalam few months lah. Few months, there few session of injection. And then usually once it's remission, right? Once you give injection, the treatment to is in remission, then you recover. It's just that sometimes autoimmune ni can be triggered.
Triggered
so maybe
because
you
of what?
stress ke ataupun environment and all that, dia akan jadi sikit. But most of them once they recover to remission process can be quite long. And they might not get it again. So
is it more to men or women?
Can be either one.
So kalau perempuan rambut pendek mungkin nampak lah kalau macam, sebab dia selalu macam
tumpuk.
Tumpuk because sekali pandang nampak kita macam lebih kurang panau tapi dia dekat kepala kan.
Kat kepala.
So macam bila kawan kita dah tunjuk what is this? Okay.
Betul. I've seen quite a number.
Of course lah. Alright. Okay. Okay, doctor, thank you. So